Up first this evening, Health Minister Dr. Christopher Tufton is insisting that doctors are not being laid off due to budgetary constraints caused by COVID-19. This as the Jamaica Medical Doctors Association says it's frustrated at the manner in which several doctors have been left without employment, allegedly because of budgetary constraints affecting the government's coffers. The JMDA says scores of doctors have turned up for work at health facilities only to be told there is no work for them. Giovanni Dennis has the story.
We are hearing that it could be as many as 40 doctors that are currently just sitting waiting on employment.
This, for President of the Jamaica Medical Doctors Association, Dr. Elon Thompson, is unprecedented. And he's not only concerned about unemployment issues, but also the untidy manner in which it's being done.
We have gotten reports of persons turning up for employment when they were told that they would be employed. And they have actually been turned back from the job. I think there is currently an effort to try and figure out how to get these persons employed. But I mean, it speaks to a bigger issue of why it happened in the first place.
And that's the meat of the matter. In the midst of a global pandemic, why are doctors being turned away from work?
The only rationale we've been given is the issue of budgetary constraint. That's the only rationale we've been given so far.
And so, the JMDA is seeking answers.
We have requested an urgent meeting with the Ministry and the Regional Health Authority to try and get some insight as to what is happening in this matter.
In the meantime, Dr. Thompson says doctors are overworked and the current situation will make things worse.
This is a short-staffed situation. And we are trying to, the government is trying to reopen the economy. And I guess persons are getting more and more open to coming to the hospitals again. And we are seeing more and more patients. The clinics are going to have more and more patients. And gradually we will see a return to somewhat of a normal situation as we had prior to COVID-19. And I can tell you, if it is that we go back to those numbers of persons that present to institutions, then the system is going to be severely hampered.
Opposition spokesman on health, Dr. Maurice Guy, the situation is untenable.
It's a most unfortunate state of affairs. We are in a health crisis right now with COVID. We have had to be importing doctors from other countries. And we have senior health officers who have finished their internship, and for the government to tell them that they cannot employ them is ridiculous. It is giving a signal to these very doctors that you are not wanted or you cannot be employed in your own country, and will lead them to want to migrate to countries that are willing to accept them, as they have been doing our nurses.
Giovanni Dennis, TVJ News.